kwasem dwumadi a ya won die no ehwe ni papa amma doctor fo ya wo mu se ya hwa ya rehwe wo mu ne so won ba St. Joseph's Hospital han mu dwumadi a ya won bidie na ehwe ni pa ndi se dwumati sa no se wo mamu a na wo ma no so ono so nyedin pa.
Hello, welcome back to the Chronicles of an African Diaspora Nurse, The Return. Thank you so much for tuning in once again. And today I am super excited about the conversation I'm going to have with my guest today, who is someone that I met, oh, God knows how long ago, it was 2006. So that's about 16 years now. And this was during the era of the Mida Ghana Health Project, organized by the IOM, International Organization for Migration. And what they did was they will match health workers across Europe to health institutions in Ghana. And then we will go on these assignments. And that's where I met you, in one of the workshops. And I can't even begin to describe, the scope of the work that you are doing, not only in Ghana, but in West Africa as well. And I'm so excited about this. So can you just tell us about your name, your role, and how long you've been a doctor for?
Interesting. My name is Paul Ofori-Atta. I'm an orthopedic surgeon. I work as a consultant in Ghana. I still run the charity which my family founded 17 years ago, Motec-Life UK, organizing people to go down, staying chairs, and also getting people to go to London for training. So that is going on well, except COVID. I did my basic education, medical education in Ghana, Colombo, and then actually left the shores of Ghana for UK in 1989. So I've been away for that long, but I've been back a few times thinking that I'm coming to help, and it didn't work out. And for that reason, when I learned my lessons, I was encouraged to form the charity called Motec-Life UK. Now, there are reasons why I formed it, but what people forget is that when you work in the developed world for so long and you want to come back, you are likely to fail. Unless you keep coming and working with the people to identify the problem areas and addressing with them, not addressing it yourself, addressing it together with them.
Yeah.
If you think that you want to tell them what is wrong, it's not going to work. Together, you should identify what is wrong.
Okay.
And they will not feel offended. But we decided, okay, we're going to work in the theater. We're going to microbiologist. We're going to take a few swabs from somewhere. We're going to grow in the lab, and you can see it. Let's do basic cleaning and let's swab again and culture. They themselves will see please filthy with bacteria. Yeah. Simple cleaning. You are not only dirty, but they know what to do to get it better. But as somebody will say your theater is so dirty, you leave the theater, will clean and do the work.
Okay, thank you so much. What would you say has been your greatest achievement in your whole medical career?
Well, I think that for me, being able to give back is the greatest thing, Probably secondary school, I paid school fees, my father paid school fees, but university education was free, completely free. So to be able to learn something and bring it back to the country, to me, is an achievement. That's number one. The others, I'm still trying to do more to be able to talk about it.
But what inspired you to give back to Ghana?
I think it all started from a visit in 2006 to Ghana. Yeah. Prior to that, I was paying visit to my parents, my father, with my wife. They will go to my wife's people and then fly back to UK. That was the way we made it in the past. But on one occasion, we thought we need to see our friends, our colleagues. So I visited Ofori-Atta Surgeon also to see one colleague of mine. And what he said orthopedic hospital, what I saw on the walls was very appalling. And he threw the challenge that what you an orthopedic surgeon, my wife is a scrub nurse, so what are you going to do about it? And I felt it was really difficult, but with a few things we could do, it made me convinced that you can start with something very little.
So now tell us about the projects that you are involved in. I mean, there are many projects, and I don't know which one you would want to choose, but tell us a bit more about some of the work you're doing.
Yeah. Live UK charity has several wings.
Yeah.
Okay. What I do is just one small part of it. I'm an orthopedic trauma surgeon and I concentrate on orthopedic trauma.
Yeah.
But the others who deal with breast cancer, thyroid, hernia, pediatric deformities correction, spinal operation, brain surgery, public health, malnutrition, support for malnourished children.
Yeah.
So you name it. There, I build schools, we build schools that in villages that they need help. I have built a surgical center to help people solve the Western region. So see, I mean, there are so many I can't mention, but the reason why they continue to grow is that Motec volunteers take on the challenge.
Yeah.
I take on my challenge. We only, communicate to consult each other, how things are going. And that's why a small charity can do so much. In the past, we used to work in 6 regions out of the 10 regions in Ghana. Now there are 16 regions and I've lost count. I don't know which region they are, but yes, we cover virtually the whole country.
Yeah. And that's one of the, things that I admire about your whole organization is that it's so diverse. It's so diverse. Yeah, so diverse with all specialties. How have you managed to, keep it going like this?
I think when we started as a charity, we were, for the first 2 years of the charity, my family funded everything.
Yeah.
Then, of course, media got involved, and media decided to support by giving out funds, tickets, and co. But I found out that giving money to people to travel, to go and work, probably wasn't the solution. You wanted to find the people who had a passion to deliver, which means I had to stop the funding. I found out that it was doing no good. Yeah. If people hear about money coming for tickets and whatever, people come in as if they're going on holiday.
Yeah.
So once that was, I could find those who were dedicated, those who really wanted to do something good. Out of their own pockets, sometimes they bought their own tickets. The good thing is that the hospitals in Ghana institutions provide accommodation, to provide us with food. You buy your ticket, you come in, transport is there for you. It's easy to deliver.
Yeah, it's true, when you have the passion, and I mean, you would be willing to sacrifice what is your time, your funds, even all the little inconveniences, because you know what you want to, achieve. So, the impact, I'm sure there's been great impact with all these projects and assignments that you're doing. Can you tell us a bit more about what you've seen as a result of your projects in people's lives?
When we started charity work, together with the people on the ground, the hospitals, the target hospitals, identify the problems together. Yeah. You have so many patients staying on the ward for several months, so many patients waiting to come in. What can we do about it? And you educate and you change people's ideas. So things like the way the hospitals work have changed. Yeah. The new guys who have come in have no idea how the transformation occurred. Yeah. And the important thing is that do the changes with them. Don't impose. Yeah. Let them understand together that we do this, we will achieve something better. Yeah. There were some odd operations that people were doing in the country. for patients because the patient didn't have the money. And of course, patients didn't have the technical know-how. So education became a factor. And you see, I am growing old. I know I will leave the system.
Yeah.
So for the past 6-7 years, the emphasis is on getting some of the chaps to top up outside so that they can come in and they born and come back working. So that if there's an area that they have deficiencies, together with the hospitals to identify groups they want to train. As of now, I've got about approximately 12 people training in London.
Wow.
Some of them have completed and come back, some are yet to complete, and another batch is about to go. I'm well aware of brain drain, so I work it out in such a way that they are with the hospitals all the time. They come back on their leave to work with the hospital, and they are proud of it. The hospitals are proud of them as well. So it's a give and take. Yeah.
Wow. That is a lot. That is a lot. You know, thank you so much to you and your team. And it's a legacy you are leaving.
Well,
it's a legacy. And what would you like to be remembered by?
I don't know what to say, but I want to go making sure that the people can do the kind of job that I do. If I'm unable to get that, it means I've failed. So if a thyroid surgeon comes to the country to operate on thyroids in the locals, and they cannot train people to take on the job when they are gone, we have failed. A number of charities come from abroad and operate and go. They don't train the locals. That is not good. That is what should be done, so that if you are not coming, like the COVID came, some of the teams cannot come from abroad to come and help. If the people have been trained, they'll carry on. These services are happening all across the country due to education and encouragement and affordable implant. So that's remembered as the simple go man who tried to do a little but has had an impact on the country.
Wow, absolutely. Thank you. Thank you so much. And I know that, you know, you started this 17 years ago.
Yes.
God, I can't even imagine the number of trips you've done to Ghana. And, you know, liaising with people, partnering with people, and, you know, working with different hospitals, different groups, different professionals. What has been some of the challenges that you faced? Because I'm asking this for someone who is now up and coming, they want to go back and do something, and they are really not sure because of the perceived problems and challenges. But obviously you've done this for a long time. You've been able to overcome, and you are still doing it. You have the passion. So tell us about what are some of the challenges and how you overcame them.
A lot of it is about learning how the system works. See how your experience can modify it to improve. It's not about coming with your ideas and implementing them. You can't. You need to work with the people on the ground, identify the problems with them, and move forward with them. That's the solution. Don't come in thinking that you're coming to change. We are going to change it together with the people. And also, the hospitals or collaborators need to see you as a serious person. The first year or so might be difficult, but once they understand you and you understand them, it takes a phone call to say, this team is ready. Are you ready for them? So I don't have to do much. These days, the emails and the WhatsApp and go are there. So it's not as difficult, even though there are probably about 12 different Motec teams. It's not difficult at all. They can organize their programs themselves and consult if they feel they need help. But at least I'm notified of what it's about. I'm happy that I'm happy for them to get on with it. It's not difficult.
Thank you.
But don't go in thinking that, yes, I'm doing this in UK, I want to do the same thing here. No, don't do that. Go in, watch what they do, and suggest what can be done. And you lead by example. Use some cases as an example. Let them see the outcome of it.
Of your work.
They themselves will tell people the other operation that you used to have that were done were not right. This is the right operation. We educate the people for you.
Yeah. So the outcome of your work actually speaks for itself.
Exactly.
Yeah. Do you think that it's good to know people back where you want to go and implement whatever you want to implement? Do you think it's good to have, because sometimes you hear or somebody has this idea and they just get their bag and then they go that I want to come and do this and that.
Yeah.
You think when you know people in the system, you have links, it helps?
Ideally, when you know from the system, it helps.
Yeah.
But that, if you don't know, which should not be an obstacle.
Yeah.
You need to talk to them. Your first 2 or 3 visits should not be about working. It's about meeting people, talking about what you think you could do together.
Yeah.
And they might see the light in it.
Yeah.
And the important thing is that if you do the work very well at one station,
yeah,
the other stations will come for you.
Yep. Yeah.
So let your work speak for you.
Yeah.
But it doesn't matter. Ofori-Atta is where I started charity work. Well, my colleague was there, but he was not a surgeon. He was a general surgeon.
Yeah.
And he did not establish the work for me. We went in and decided with them what we thought we could do. The first visit was education, discussions, see how they manage their cases and make suggestions and examples.
Yeah.
Not the time or pride.
Yeah.
I mean, sometimes the other thing I notice is that some people can feel have bad feelings, thinking that you might want to take their job because you can't be used. It is true. But you got to be very gentle.
Yeah.
You got to make them aware you got a secure job somewhere. You want them to. It's human, hungry human beings.
It's true.
All part of it.
It's true, you know. Yeah. So now you are currently in Ghana. What is it that you want to implement at this stage?
Well, I think that it has got to a stage where majority of what I think I should introduce to Ghana have been introduced in my orthopedic field. Arthroscopies, camera joints, which I've introduced to great people. Putting the joints into people that have got disease joint, I've introduced. Fixed bones probably I've introduced. And those that I introduced to a trainer doing the job elsewhere. But there are other areas that I feel needs a lot of help, especially kids, pediatric orthopedics. Right now, next month, for the first time, one individual is going to London to get training. Yeah, people have to go to London for top-up. Yeah. Ghana to help. Pediatric orthopedics is really close to my heart. I gather patients from across the country. I run clinics, screening them and then getting the patients admitted. We do plastic. I get plastic cases that you cannot otherwise get into any system for treatment.
I wanted to ask, you're using a lot of your, sacrificially, you are paying for staff.
Yes.
Do you think funding can hinder such work, or how have you overcome that? Because obviously there's a lot of money needed.
Funding can help if you can get support from elsewhere. But one must remember that some people are interested in funding for their holiday. But in Ghana here, you can get collaborate and go to some of the companies. I don't do that because I feel I have the resources. Why? My aim in life is not to amass wealth, it's to deliver. I'm a farmer as well, so it's not just the money to give, but I also got a source of money coming from my farms.
Wow.
Yeah.
Wow. Thank you so much. The last question I was going to ask was, what message do you have for the African diaspora, especially healthcare workers?
If you look at it very carefully, we cannot take all our family members abroad.
Yeah.
And if you are working in health, you find out that you contact the people in Ghana here, you try and help your auntie or mother who is not well.
Yeah.
If they have not been trained up to deliver the services, you're going to lose your aunt or your uncle. I mean, you are not planning to treat your uncle, but you're trying to train people so that they can look after everybody else, including your own family members.
Yeah.
Most of us were given the support by the public in Ghana. Think about what to give back. Are they training? For the expertise? Why do you want to sit on it? And indeed, some of my African members do demonstrate that they want to get something out of whatever they do. And if you demonstrate that, I'm afraid you will not be part of my charity.
Yeah.
But those who feel that they have to give
are
the ones that are always happy.
Thank you so much. You know, there's a lot of sacrificial work that you are doing. It's very encouraging and inspiring to me, and I'm sure to other people as well that, you know, they will be inspired about the work that you're doing. So the last question is
Yes.
optional. Do you see yourself settled in Ghana anytime soon?
Well, I spend 60-70% of my time in Ghana now.
Wow.
So I'm more settled here than settled in UK.
Okay.
So effectively, I'm in Ghana.
Good.
I go back and get involved with a few lectures, few meetings that are relevant to the church work I do.
Yeah.
I don't go there for holiday. I go source things that I can use or my team can use to help people.
Yeah.
So I'm in Ghana.
Okay.
I'm happy.
Great.
The sun is out. And I can take my sunglasses anytime I want.
Anytime. Wow. You make me jealous. Yeah. So how can you be contacted in case somebody hears this and said, oh, I want to volunteer to be part of the organization, which is Motec-Life UK? How can they get in touch?
Yeah. Majority of people go to the website.
Okay.
Motec-Life UK, you get a hope.
Okay.
And there's contact us either through the webmaster or inquiries. It comes to the email, come to.
Okay.
And so Motec-Life UK, you just go for it, and then you will be able to contact.
Yeah.
And I'll direct you. I support you. I support other groups that are not within my charity. That are people just like in Senegal or Liberia. They want the price as well.
Yeah. It's exciting times. Yeah. Thank you so much, Dr. Ofori-Atta, for your time.
Pleasure.
And
nice.
Yeah, I hope this has inspired someone. Okay.
Hopefully.